Hello and welcome. Today, we are diving into a huge milestone in your pregnancy journey, week 28. And this isn't just any old week, you know? This is it, the official start of the third trimester. It's such a pivotal time, with incredible growth and change for both you and your baby. So, let's get right into what this exciting new chapter has in store. And wow, what a world it is inside that belly. Thanks to some pretty amazing 3D ultrasound technology, we actually know that by week 28, your baby is already showing off their little personality. I'm talking smiling, grimacing, maybe even sticking their tongue out. It's like there's a whole secret life happening in there, and we're about to get a little peek. So here's what we're going to cover. We'll start with a look inside the womb. Then we'll check in on how your body is doing. After that, we'll decode what's going on at the doctor's office. And finally, we'll talk about the social and emotional side of this whole adventure. Okay, first up, let's talk about the star of the show, your baby. What exactly is going on in there? Well, their world is getting more complex and honestly more fascinating with every single passing day. Just look at this list. It's an absolute explosion of development. Your baby isn't just making little faces. They're yawning in a more coordinated way. They're practicing breathing. Their eyes are officially open, and they've got their own sleep cycles. Oh, and get this. They're growing their very own eyebrows and eyelashes. How amazing is that? That's right. Those kicks and then those quiet spells, they're starting to become a lot more predictable. Your baby is actually settling into a sleep-wake cycle that's really similar to a newborn's. You might even start to notice a pattern, right? Like maybe they have a dance party right when you're trying to fall asleep. It's kind of a little preview of what's to come in just a few months. So you might see practicing breathing and wonder, how does that work? Well, they're not breathing air, of course, but they are making these breathing movements. And this is absolutely vital for their lung development. See, their lungs are filled with this special fluid that they produce, and with every little practice breath, they push tiny amounts out. It's like weight training for their lungs to get them ready for their big debut. And you might be curious about which way your baby is facing. Right now, they're just enjoying the space, flipping all over the place. It's totally, completely normal for about a third of babies to be in a breech or bottom-down position at 28 weeks. So don't worry, there is still plenty of time for them to get into that head-down position before birth. All right, now let's shift gears and talk about you. All of that incredible development has a pretty big impact on your body, which is basically working overtime right now. So let's get into what you might be feeling this week. Does it ever feel like you just walked up a flight of stairs, even when you've just been sitting on the couch? Yeah. Feeling short of breath is one of the most common things around this time. As your uterus gets bigger, it starts pushing up on your diaphragm, and that can make taking a nice, deep, satisfying breath feel like a real challenge. But here's a wild little fact. Even though you feel like you can't get enough air, you're actually taking in more air with every single breath than you did before you were pregnant. Your body has just become way more efficient at processing oxygen to keep up with the demands of both you and your growing baby. Pretty cool, huh? Now, another really common issue is something called pelvic girdle pain, or PGP. And if you're feeling it, you are not alone. It affects about 1 in 5 pregnant women. It's caused by hormones that loosen up the joints in your pelvis, and man, it can range from just being a little uncomfortable to being seriously painful, especially when you're walking or climbing stairs, or even just trying to roll over in bed. The good news is you can do things to manage it. Little adjustments, like trying to keep your legs parallel when you get out of the car, can make a huge difference. Sleeping with a pillow between your knees is a game changer for aligning your hips. And, listen to your body. Avoid stuff that just plain hurts. Definitely don't be afraid to ask your doctor about things like a support belt or even physical therapy. All this growing takes fuel, right? So in the third trimester, the general guideline is to add about 200 extra calories a day, maybe a little more if you're exercising. It's not really about eating for two. It's more about just making sure you've got enough energy for this final, really intensive stage of development. Okay, let's talk about your prenatal appointments. At this stage, you'll probably be going more often, and your doctor is going to be keeping a close eye on your baby's growth. So let's break down what all those checks and measurements really mean. One of the simplest but coolest tools your doctor uses is the fundal height measurement. They literally take a tape measure and check the distance from your pubic bone to the very top of your uterus. And the number of centimeters should be roughly the same as the number of weeks you are pregnant, give or take a centimeter or two. So, what happens if that measurement is off by, say, 3 centimeters or more? First thing, don't panic. It doesn't automatically mean something is wrong. It's usually just a signal for your doctor to set up an ultrasound just to get a more detailed look at how your baby's growing and check on the amount of amniotic fluid.
So the ultrasound data gets put on what's called a growth chart. You'll see these curved lines. The one in the middle, the 50th percentile, that's the average. The lines for the 10th and 90th mark the normal range. But here's the most important part. What doctors really care about isn't one single dot on the chart, it's the pattern over time. They're looking for a nice, steady growth curve.
Now, if there are any concerns about growth, your doctor might order a Doppler scan. This is a special kind of ultrasound. It doesn't just look at the baby's size, it actually measures the blood flow through the umbilical cord and the placenta. It's basically a way to check if the placenta is doing its job and delivering all the oxygen and nutrients your baby needs. And these images show you exactly what they're looking for. On the left, you see a normal reading. See how that flow is consistent and continuous? It's a nice, steady supply. Now look at the right. That's an abnormal reading that shows resistance. You can see how the flow dips way down. That can mean the baby's heart has to work a lot harder, and they might not be getting everything they need. Okay, finally, let's zoom out a bit from the physical and the medical stuff and talk about the world around you. Because pregnancy doesn't happen in a bubble, right? Week 28 can bring its own unique set of social and emotional challenges and changes.
Ah, yes, the unsolicited advice. Suddenly, it seems like everyone you meet is an expert, doesn't it? From your family to total strangers. The key is to just remember that most people really do mean well. A simple, polite, "Thank you so much for your concern. We're working really closely with our doctor," can be a fantastic way to acknowledge what they said without feeling like you have to follow every piece of advice you get.
Your workplace can also become a bit of a tricky landscape to navigate. You might start to notice that colleagues are leaving you out of conversations about long-term projects. They might just assume you won't be around or that you won't be as committed when you come back. The best way to handle this is to be proactive. If you are planning to return, make that super clear. Keep contributing your ideas and expertise, and by actively helping plan for your own maternity leave coverage, you're showing everyone that you are committed to your team and that you want to make sure there's a smooth transition for everybody. You know, as your baby grows and your body changes, your whole world just shifts in these really profound ways. Whether you have a partner, or, as the source material points out, you're preparing to be a single parent, having a strong support network is just everything. So the question I want to leave you with is this. In the middle of all this incredible change, who is your rock? Who are the people you can lean on? Because that is your most valuable resource of all.